I'm Chanel. I came to Dr. Gaon's office to talk about a lower facelift. I recently got the lower facelift. I came in, consultation was amazing. His office staff were very warm, walked me through the whole entire office visit. I came in, Dr. Gaon came in, explained one by one what I'll be experiencing. He takes his time with you, tells you exactly what you're going to be going through. His bedside manner is warm. It is not hurrying. It's not just give me a check and leave. It takes his time. He makes you feel like you're going to get exactly what you wanted, and he knows how to do it. Since then, I've referred many friends of mine to Dr. Gaon, and they refer their friends. Coming out of surgery, I couldn't believe I was walking around the very next day, no pain whatsoever. I went to one of his facilities with his nurse and we did a 24-hour. The next day she drove me to my house. She told my husband everything that he needed to do for me. The follow-up with Dr. Gaon was great as well. He called me a couple times at home. I came in, I think on a Thursday. We had the procedure on Saturday. I came in on Thursday and he said, you can do whatever you want, but make sure you're not in pain, take it slow. I didn't want to. I felt great. I don't know any other procedure that I would have felt this great from. So my husband thinks of my results. Honestly, he doesn't really even notice them. He thinks I look great all the time. However, I felt like I didn't. I just wanted a couple touch-up things. Lower facelift worked amazing for me. He's very happy with it. My kids are happy with it. They weren't stressed thinking I did something horrible. They actually walked me through it and they were very happy. It was very easy. I believe my personality is very, very young, so I want to look youthful all the time. I married somebody about 7 years younger than me, so I want to stay just as young as him in numbers. However, I feel much younger in spirit.
Who is letting us take a look at her cellulite injections. So this is one of the new products on the market. It's called QWO. It is collagenase Clostridium histolyticum. Try saying that 3 times fast. It's an enzyme that digests the connective tissue that's causing the dimpling, and this can be used to treat cellulite dimpling on the buttocks and on the posterior thighs. Works very nicely. It requires 3 treatments in succession, about 3 weeks apart. It's not very painful, but the downside is that in between treatments you will have some some bruising, that's because a little bit of those smaller blood vessels are also taken care of in terms of the collagenase, the enzyme activity when we're trying to break apart all that tension that's holding down the dimpling for the cellulite. So we have a young patient here, and this is to show you that she's extremely fit, but even the fittest of people still have some issues of cellulite, which is genetic. So we're going to focus on a couple areas that we're going to be treating. Wherever we're seeing this little bit of dimpling, we're going to place our little mark because that's where our injections are going to be. And we're going to be treating the back of the thighs today for our patient. Keep turning. Flex a little bit. Right? And so anywhere where there's a little bit of tethering of tissue, we're going to inject it, try to get this to pop out and to be perfectly smooth. Okay, so I'm going to count out 1, 2, 3, 4, 5, 6, 7, 8 spots over here on that leg. Let's go to the other side. This one has a little bit less, but we can still see these areas that bother her, especially because we're coming up on swimsuit season, so it's important to get this done now so she has time to recover from the bruising, which is a side effect of the treatment, just in time for summer. Okay. Today we're going to do some rhinoplasty with fillers and some threads. So to look at the anatomy a little bit, we can see that she's got a little bit of deficiency here that we're going to fill in with a little volume. We have a slight bit of a dorsal hump we're going to camouflage, but mostly we want to provide some tip support. I want you to kind of blow, we want to support that tip by putting in the mini threads here and also along the dorsum. Will help to define the dorsal aesthetic lines, and then we're going to soften it with some threading. We're also going to narrow the inner base here a little bit with some cross threading so that we have nice harmony. And we're going to top that off with a little bit of cheek lift. So a couple of small threads here just to give this cheek a little bit of pop to lift that up to put her face into some balance. Okay. Hardest part here is the numbing, but we're going to use a little tiny Botox needle. So this is the part where it's going to sting a little bit. I'll give you a little tissues, kind of wipe the tears out of your eyes, but we'll go nice and slow. If you need to take a little break, you say break, and then we'll stop. The threads they're barbed, but I don't like to really call them barbs. They're more fins that have been molded onto the threads themselves. And so they're going to last a lot longer and have a better bite than the threads we've been using in the past. You get two effects, one from the pulling and then the second from the collagen creation from the hydrolysis and breakdown of the thread along the areas where we place it. So you get a little bit of filling as well as the pull.
You know I meet you at your place of mine. I'm calling your bluff while you're lying to yourself. If you wanna know what I see in my mind, just say the word and stop wasting my time. I'm calling your bluff while you're lying to yourself. I can't get on with you when I'm alone with you. There's no telling what we'll do, no telling what we'll do, and I can't help myself 'cause you're the one I want to see.
One of the more common procedures that I do, we call the mommy makeover. And this is a procedure that I love performing. It's absolutely transformative. It's a term that's used in marketing the procedure more than anything else because it can mean any number of different things, all having to do with what happens to the female body after childbirth. So commonly we combine some sort of body surgery with a breast surgery. When we do those together as one procedure, we term that colloquially a mommy makeover. It can be a combination of a breast augmentation and some liposuction. It can be a breast lift with a mini tummy tuck or a full tummy tuck or any other permutation. So what we like to do is do the abdominal assessment first. We take a look at the amount of excess fat. We take a look at the laxity of the abdomen from having had multiple childbirths, and we determine what the best course of action is to treat the trunk or the abdomen. After we determine that, we take a look at the breast and see if a simple implant may make a difference, or adding some volume with an addition of breast lift in addition to the implant, utilizing some mesh for an internal bra support, and or doing the lift alone in conjunction with the body work. All right, we have our patient back here from 1 week after surgery. We did a liposuction and a mini tummy tuck. So when you combine a mini tummy tuck with liposuction, sometimes you can call that a marriage abdominoplasty, because you're marrying the liposuction to the tummy tuck. The tummy tuck results in removal of the lower abdominal tissue and skin, and then the liposuction gives you that nice form. So let's have a look. She'd had liposuction before, but after the last surgeon did the procedure, she had a lot left behind in the upper area, including over the rib cage and here centrally. So what we did is we went in and really thinned that out to give her this nice central depression up top. We also did a lot over to the sides to give her this nice waistline definition. And then finally, we took about this much skin, brought that down to this lower incision. So we'll do the grand unveiling today and take the tapes off and see how that's healing underneath. And that's all absorbable suture, so there's nothing to pick out or take out. All we have now is just a little bit of scabbing and some tape and glue residue, but looks great, staying nice and low, so it's always going to be covered up by the bikini line. And it's a wonderful result, even in a week. The nice surprise about this is that she's still swollen, and so this is going to get better and better and better, and we're looking towards the final result in about 3 to 4 months. Breast augmentation is still an extremely popular procedure that we do here. Some patients come in thinking that augmentation alone or the use of implants is going to solve all their problems. However, anatomies differ, breasts differ, and if you have a patient that has a lot of loose skin, stretch marks, sagging of the breast, a low position of the nipple and the areola, sometimes the better procedure is to perform a lift along with the augmentation, and that's going to create a more compact, a perkier, better formed breast, albeit with a couple of extra scars that we can nicely hide, but it's going to last a lifetime longer than simply putting in an implant or using too big of an implant, which can result in many more problems down the road.